And I will the Canadian Public Health Association, and I'm pleased to welcome you to today's virtual Public Health Journal Club. I just want to start by acknowledging that while we're gathering from all parts of Turtle Island on this virtual platform, CPH's offices are located on the ancestral and unceded territory of the Algonquin and Anishinaabe peoples. And CPHA is committed to meaningful truth and reconciliation with all First Nations, Inuit, and Métis people. And we're very pleased to announce that starting in 2021, we will have a new Indigenous Advisory Council that would be providing overall guidance to the association and the board of directors on its policies, programs, and other initiatives. So with that, I will now turn it over to CPHA Student Director, Monica Amode, who will be your MC today. Monica.
Thank you, Ian. So thank you everyone for being here today. It's my pleasure to welcome to our third virtual journal club, held in partnership with the Canadian Journal of Public Health. So at CPHA, one key area of our work is to advocate for public health, speaking up for people and populations to all levels of government. We champion health equity, social justice, and evidence-informed decision-making. We're a catalyst for change that improves health and well-being for all. Our vision is a healthy and just world, and our mission is to enhance the health of people in Canada and to contribute to a healthier and more equitable world. The Canadian Journal of Public Health is an independent journal that publishes peer-reviewed original research and scholarly articles submitted in either English or French that are relevant to the population of public health. This journal aims to advance the public health research and practice in Canada and around the world, contributing to the improvement of health in populations and the reduction of health equity. So for the past 4 years, we have been holding a webinar series to engage our members. Initially, the series was primarily intended for students, trainees, and early career professionals, with the goal of promoting public health careers. You can find the recordings from these past sessions on our YouTube channel. This year, we are holding a series in partnership with the peer-reviewed journal that we publish, the Canadian Journal of Public Health. Each month, a graduate student will critically appraise a different journal article and will engage the paper's author in discussion. A committee of devoted volunteers have identified the first 4 papers. Registration for the webinars open up a month prior to them taking place. So our hope is that this journal club series will provide a supported learning environment for our participants to keep abreast of the current public health literature, develop skills and competencies in critical appraisal, and expose participants to a range of methodological and analytical approaches used in public health research. We hope that you'll find these sessions to be invaluable throughout the year. You can follow along in the conversation using the hashtag CJPH_JClub, and we encourage you to tweet out responses from this webinar. And I'm very much looking forward to another fruitful and thoughtful presentation today. But before we begin, just a little bit of housekeeping. So all participants are muted, but we hope to engage you throughout the webinar through polls and other features. The toolbar at the bottom of your screen has a few features. So if you have general comments, please post them in the chat box, and these will be visible to all participants. We encourage you to chat about yourself on Twitter, as I mentioned. And if you have any questions for the presenters, please post them in the Q&A box visible to all presenters. Your questions will be answered in sequence. This webinar is being recorded, and the recordings will be available to all our members and registered participants shortly following today's session, and slides and recordings will be more broadly available in 3 months. And now for a very exciting part, I get to learn more about you. Sorry, just 1 second. Seems set.
Yeah. Unfortunately, Monica, it looks like the polls weren't set up. So we'll have to forego those today.
No problem. Well, without further ado, I'm very much looking forward to introducing today's presenters. So we have Kabisha Velauthapillai, who is currently an MD student at the University of Toronto. They recently completed their MSc in epidemiology at McGill University, conducting research on exposures to air and noise pollution in urban Columbia. And during this time, Kabisha also conducted oral history research with the Center of Oral History and Digital Storytelling at Concordia University. Prior to this, they completed a BSc in Environment on the ecological determinants of health. And during their final year, Kabisha led a research project on environmental concerns and conceptions of racialized migrant communities with a focus on Sri Lankan Tamil community in Montreal. And our author, Dr. Blake Poland, professor at Delaware School of Public Health, and the director of collaborative specialization in community development and co-director of the World Health Organization Collaborating Center and Health Promotion at the University of Toronto. His work focuses on primarily community resilience, sustainability transitions, citizens, and social movements as agents of change in community-based and critical qualitative research methods. So I'll pass this over to Kabisha to begin her presentation.
Sorry, just a moment as I get my screen set up. There we go. Is that visible? Okay, perfect. And does it fit the screen adequately? Okay, perfect. Great. Thank you, Ian and Monica, for those introductions. And as Blake mentioned, for the very important land acknowledgement. So I will start by giving us all an overview of the paper. So as Monica mentioned, the paper is called The Psychosocial Adaptation to Climate Change in High River, Alberta, Implications for Policy and Practice. So I'll start with a rationale and a background, and then move into the methods, which focus on a qualitative approach, get into the discussions, followed by a brief discussion on the discussion and conclusion of the study. So in terms of the rationale, we need to understand what the implications of climate change are first. So climate change has several long-lasting impacts on our environments, as well as on human communities. And one of these impacts is the increased frequency and severity of natural disasters like droughts and floods. So for instance, the IPCC 2019 report describes that from 1950 to 2012, there's increased runoff and precipitation in Western and Eastern Canada, as well as other regions of the world. And we know that these natural disasters have long-lasting effects on affected communities. And in addition, the burden of climate change is enhanced for people who are already facing health inequities, so for marginalized communities. Part of the impacts of natural disasters on human communities include psychosocial impacts, both negative, which are covered by the paper in terms of the mental health impacts, as well as some positive outcomes in terms of how communities can respond to these. For instance, it could promote an increased sense of strength in terms of an increased sense of community, actually. So in terms of responses to climate change, there are often two major areas of focus. And the first is mitigation. This involves trying to prevent or decrease climate change. And some initiatives can include establishing and enforcing carbon taxes on polluting industries, for example. And then the second response that we see is adaptation response. And this involves acknowledging that climate change is occurring and will occur so long as we remain in a business as usual state, or so long as we continue to not have the necessary action steps to mitigate climate change. Essentially, adaptation promotes the resilience of our ecological communities, and so finding ways to cope and be proactive in our responses to climate change impacts. And so some examples of this adaptation response can look like rebuilding or strengthening physical infrastructure to withstand floods. It can also look like being proactive about preparing communities for potential downstream implications like natural disasters. So taking more of a psychosocial approach. So in the literature, the gap that has been highlighted by this paper is that while the impacts of climate change have been studied in terms of the psychosocial impacts, there's still a gap in the literature and in practice about effective interventions to promote psychosocial health and adaptation of communities affected by climate change impacts. And this is especially the case for marginalized communities. So I'm going to move on now to the background. So this paper is based on the 2013 Southern Alberta flood in the town of High River. It's a rural area with a population of about 13,000 people. And on the day of the flood, or actually post-flood, the whole town had to evacuate because of flooding. And it's also a town that's located in an area where flooding often occurs. So while we can't associate this specific event to climate change, it's part of a larger story of climate change's overall impact on the trend of flooding. So what this case study does provide us with is insight for a larger conversation about psychosocial adaptations for future events. So guiding this study are two main research questions. The first was, what have been the health and social service responses to long-term consequences of the 2013 flood in High River, Alberta? And the second is, how can an understanding of these responses support community-level psychosocial health promotion in a changing climate? So the study also draws from a political ecology lens, which is a theoretical model that recognizes the influence of socio and political factors on the relationship between humans and the environment. And it also draws, very importantly, from the lived experiences of community members. So I'll get into the methods now. So the who and the how. So there were three different groups of participants, and each had a different interviewing method. So I'll start with the phone interviews that were used for key informants. These were leaders, key informants were leaders in health and social services. There were a total of 14 people who were interviewed. And the organizations that they represented were already, some of these organizations were already present in the town prior to the flood occurring, but there were also representatives from organizations that were external, so that came in as a result of the flood, so in response to the flood. Key informants also included faith-based representatives who held a leadership role in community. So some of the questions that were asked, or some of the topics that were included, were on the types of psychosocial supports available to High River residents before, during, and after the flood, barriers to access, as well as their thoughts on climate change and mental health. Then there were focus groups with health and social service frontline workers who were providing psychosocial support for community members. And there were a total of 14 people interviewed or involved in focus groups in this case, and they consisted of both community and response service representatives. Some questions or some topics that were asked about were on identifying community groups or individuals who provided psychological care or social care of some form during or before or after the flood, as well as resources that addressed climate change that they were aware of. And so lastly, but certainly not least, there were semi-structured interviews to engage flood-affected community members who self-identified as being marginalized. And so people who were interviewed included people who identified as being low socioeconomic status, female, youth, people who were elderly, people who had pre-existing health concerns, as well as racialized folks. And some questions that were incorporated included, or some topics that were incorporated included asking about people's lives in their town and possible environmental changes that they may have observed over the course of their lives in the town, as well as perceptions of climate change impacting mental health and how resources to support mental health and well-being could be improved as well. So I'll transition now into the analysis portion. So this paper took a thematic analysis approach it conducted a thematic analysis with a descriptive approach. And it involved identifying emergent themes in the data. And to do this, researchers used 5 main steps. The first was to become familiar, to get to know the data as they went through the interviews. The second was to then produce initial codes for parts of the interview that may contribute to larger themes. The third was to go through these codes and interviews and to review them, contributing to theme construction. The fourth was then to go through these themes to then define them and name them. And finally, they produced a report. And so one of the very interesting and very important challenges that the paper highlights is this process that researchers had to go through in terms of questioning, what consists of a theme essentially. And this was usually defined by the reappearance of a thought or experience in multiple interviews. And what I found really interesting and what really drew me to this part is that it was a big strength of the study when it considered the context of marginalized community members. I quoted I took note of one of the questions that were included in the methods section that the researchers sort of touched base with themselves about. And it was, what are the unsaid or silenced themes that ought to be considered? And this, I can see this as allowing one to, like, as a researcher, to make space for experiences and perspectives of community members who may otherwise be erased if only common answers from the majority were considered. And so I can see the research as trying to strike a form of balance between the overall themes and the themes specific to marginalized communities or individuals, which are so vital to recognize and engage with. So it sheds light, this approach actually sheds light on a deeper question relating to power dynamics in research contexts and whose voice is recognized, whose voice is prioritized and even validated when we're considering themes. And so I really found this to be a strength in the paper because I could see it being, really incorporating critical perspectives in qualitative research or critical approaches. So now I'll get into some of the results. There were 3 main themes that emerged from the collective of interviews. The first was the difference between response and recovery interventions. So many key informants identified a major challenge, which was that response interventions by external organizations were temporary and focused on emergency psychosocial services, while recovery was primarily led by community-based interventions, which were present prior to the flood too. And they highlighted the need to recognize that psychosocial impacts of the flood were long-term and corresponded and also needed longer-term recovery interventions. So both the key informants who were in leadership positions as well as frontline workers also discussed the need for increased funding in mental health recovery. Community members identified some positives about recovery services that while they weren't long-term, given that they were from a rural community, like some community members weren't as comfortable approaching community organizations and disclosing about their mental health. And so having that option to go to somewhere external and to talk about their mental health or to disclose about it was safer for them. The second major theme consisted of the unintended consequences of psychosocial interventions. So participants described the need for everyone involved in interactions with flood-affected community members to have mental health training. They also emphasized the need for continued care because for affected community members, sometimes they ended up confiding in these external organizations, starting their recovery process. But then if that community organization left, they had to start all over again and establishing or developing some form of a trusting relationship with someone again. And so that was quite destabilizing. And then organization leaders also highlighted that the influx of external organizations led to some existing organizations having to actually compete for opportunity and for resources and trying to maintain their jobs that were being filled by external groups. And so one key informant actually pointed out something really pertinent, which was the need for funding and capacity building of local local organizations and groups as a response to these recovery or these response initiatives. And the third and the final theme centered on how affected community members' perspectives of mental health care can guide response and recovery initiatives. So community members discussed the need for improved communication efforts consisting of early warning signals and accessible communication for different linguistic communities. For instance, in High River, there were a relatively higher proportion of Filipino and Mexican community members. And so because of the meat packing plant, and so there were temporary foreign workers there. And so just to have that accessible material that people can engage with. And there was also some comments about the need for improved media coverage of their area instead of just focusing on the few urban areas. Community members also described the need for awareness of mental health resources prior to the flood. They described the need for increased access to resources. So one thing that part of the interview that I found particularly interesting was that one mother describes that she and her two sons have cognitive disabilities and that they didn't have access to the necessary resources. And it's very telling because, you know, you have these conversations about climate change and how it disproportionately impacts communities or people with disabilities, as well as marginalized communities in general. And if they don't have access to these resources, who are these resources really serving when they do come about? And so another part that was really interesting was that community members also expressed that community ties were strengthened as a result of the response to this flood. And so this acted as a protective factor. And in terms, I know that I'm going a bit over time, but I'll cover the discussion briefly and the conclusion. So the results of the study highlighted that we need to consider the geographic context when considering the types of psychosocial intervention responses. For instance, some community members expressed they felt more comfortable confiding in someone outside of their community, given it was a rural area. A sense of community and services by a sense of community as well as services by community groups were seen as vital by many, since promoting cohesion was actually a protective factor. There was also mixed responses or thoughts about external organizations. While people were appreciative, there was a sense of there was resource diversion happening, as well as a lack of sustained efforts for recovery. And then while few people connected their experiences to climate change, others were skeptical, perhaps due to the political context or use skepticism as a protective factor. And so we're seeing that the findings of this study are also more applicable to similar rural contexts that have similar population sizes, so relatively smaller compared to many urban areas. So to conclude, the findings in this study have several implications for public policy, for public health policy and practice. They can inform adaptive capacity interventions on capacity building, mental health care training, awareness raising of services, promoting and developing redundant communication networks to make sure that the information is reaching the people, and providing a multitude of psychosocial intervention options. So I will refer you to table 1 of this paper if you want to find out more about that. And all these interventions also have suggested public health intersectoral actions that can also be drawn from. So I found that was quite interesting to engage with as well. So I've come to the end of the presentation of the paper, and we can transition now into the question period. I've also included some Blake's and my emails, our social media profiles, as well as some websites that could be useful for you to refer to if you're interested. So I want to ask Monica if you're seeing anything come into the chat, if there are some questions.
Nothing yet, but feel free to ask any questions, attendees.
Okay, perfect.
I just wanted to also say thank you, Kabisha, for a great overview of the paper. I think you represented it really well. And if I can highlight just one or two things, I think we don't have an extensive literature on rural health and rural mental health in particular. So that is one of the areas that I think this paper hopefully contributes to. And I think the other issue I just wanted to underscore, because it also comes up a lot in our other research on community resilience, is again, another example of the need, the recognized need for better collaboration between formal disaster response systems and local communities. And we see that call over and over again, but unfortunately not that much guidance for people doing this work on how to do that collaboration before, during, and after extreme weather events and other crises. So I just wanted to underscore those two elements because they're part of, for me at least, the broader context. And to also say that this was work that was undertaken by Katie Hayes as part of her doctoral dissertation. So I had the pleasure of being her PhD supervisor. And so obviously, you know, provided a lot of direction on key elements of the study, including methodology, but I wasn't necessarily standing over her shoulder, micromanaging every step of the way. So I'll do my best to answer your questions. But just to let you know, I'm like one arm's length removed from some of the nitty-gritties that were involved.
Great, thank you, Blake. And those points were so important. And thank you for that feedback as well. And I absolutely agree that, you know, when it comes to public health responses, both that like from a climate change perspective, but also just in thinking of COVID, that there's still such a gap in terms of working with communities on the ground. And again, particularly with marginalized communities. I've seen it in my own neighborhood where like I grew up in a place in a neighborhood in Montreal where there's a high proportion of racialized and low income communities. And there's still such a lack of accessible communication and you know, feedback and like actual involvement of community members in decision-making processes. So I completely agree with that need to strengthen those ties as well. And point well taken about Katie Hayes as contributing to the major essence of this project. And I would love to have a conversation with her at some point. So I do see, before I even jump into my question, I do see a question by Daniel. Do you think that different types of weather events will have different mental health impacts?
That's a great question. I think what we've, and this is not my sole area of focus, so I can't say that I know other areas as well. But I think part of what we're seeing from some of the wildfires, for example, and some other work that has looked at the psychosocial impacts of, for example, places that are flooded like intentionally for making dams, for example, like with the James Bay project in Quebec many years ago, where some of that initial work was done. We see that this notion of solastalgia, or loss of, you know, sense of loss of a sense of home in the environment, is a factor across a number of different disasters, which have the potential to change the landscape as people know it, and or change their sense of solidity or the taken for grantedness of the landscape. So there is this kind of existential shift that happens when things that we've taken for granted seem more precarious. So we referenced in the paper, for example, how for years after the 2013 flood, when there'd be heavy rain, kids would crawl into their parents' beds at night, afraid that there would be another flood. And so these kind of experiences stick with us, because they hit us at kind of a gut level survival basis. And we can't just trust that everything is always going to be okay in the same way. And we've heard that even from people who've been through earthquakes. We take the solidity of the earth for granted, but that shifts with a major event. We're kind of imprinted with it in some way, and we are not so quick to take things for granted. So I think there's some commonalities and obviously some differences, because wildfires are very different from floods in some very obvious ways. And yet they may hit us in similar ways in terms of everything that's involved in evacuation and losing your home or losing precious things that can't be replaced, like family photograph albums and things that hold a lot of personal significance within a family, or sometimes over generations. So there are commonalities and differences, but I think we need a whole lot more work in this area. There's still not that much research being done on mental health impacts of environmental change and disasters. And I think you can count on one or two hands the number of people who have that specialization in Canada at the moment.
Great points. Thanks, Blake. And, I was also thinking, as you were talking about this concept of home and how disaster events can really impact that and destabilize that for people, I'm also thinking about like floods on one end, and then droughts, which can have similar effects, but then, droughts are often related to like jeopardizing people's livelihoods and affecting people in that ways. And so I can definitely see, sort of in theory, how there could be different impacts, mental health impacts, as well as psychosocial impacts broadly. But I haven't seen too much literature on that specifically.
Yeah. And I think it's important to emphasize that these are not evenly spread either. So people's experience of disasters and post-disaster recovery is very much a function of their social location. So one of the things that we found in High River, for example, is that there was a floodplain that people were not supposed to build on, but the town had given an exemption, and a bunch of luxury homes went up right along the waterfront. And a decision was made after the flood that people would not be necessarily allowed to rebuild there, but the government moved very quickly to buy out all those homes at market value. And so those relatively privileged people saw, an instant return on their investment, and they were able to move on. Whereas racialized and marginalized residents in other parts of town had to struggle with bureaucracies and endless forms and refusals, and without any help or support for years afterwards, and were often denied quite a bit more modest claims, and without insurance coverage necessarily, or without the ability to recover financially as easily as more privileged residents. So one of the unfortunate things is that often the aftermath of a recovery is like a double whammy for people at the bottom of the social pecking order, because they experience all the racism and classism and barriers in the systems and their formal response systems that are supposed to be set up to help them, which add a layer of frustration and frankly, kind of shock and reinforcement of social inequality as another layer on top of what they experience with the disaster itself. So that's really important to emphasize as well.
Yeah, absolutely. And that makes me think a lot about the sort of the approach to the paper, and how at the end you bring together you highlight the need for intersectoral approaches in response as well. And so, particularly as you're saying, for marginalized communities who are already burdened by inequitable services, wider social services that already put them at a structural disadvantage, the need to actually incorporate those like responses, for instance, housing policies and incorporating strengthened housing policies along with strengthened approaches to public health responses, I can see as being so vital in responding to the care of marginalized communities. Yeah.
One thing I just want to add to that is that, so something I found particularly interesting in your discussion is that you talk about the importance of letting the local community be leaders. Can you talk a little bit more about this finding? And I think it goes off of Kabisha's point about, how for those looking to do more health equity research or even research in public health, what does that mean? So letting the local community be the leaders here in this case?
Sorry, I didn't catch the tail end of that. Letting the local community what?
Letting the local community be leaders. I think that's something.
Yes. So we actually just gave a webinar on that earlier this week, which I'll put the link in the chat box for everyone if you want to see the recording. We've started working with something called a connected community approach to building community resilience, because a lot of the resilience literature flags, as I mentioned, this importance of community and formal response institutions and systems working better together, but there's very little guidance on how to do that. And too often, it's framed in terms of labeling or positioning communities as service recipients, as needy, and as somehow, having to be coordinated with a service provision kind of lens. And really what we've seen work so well with the Center for Connected Communities and the East Scarborough storefront in Toronto and so on is a connected community approach that puts the community at the center and in more of the driving seat as collaborators alongside service providers and formal response systems, so that they can actually work together, because communities have an enormous amount of wisdom and connections and capacity to mobilize in the immediate aftermath of an extreme weather event or another disaster or shock and crisis. It's often community that's mobilized the most quickly to help each other. And it may be 24, 48 hours or more before formal response systems come in. And what we find over and over again, whether it's, retrospective analyses of Hurricane Katrina or Hurricane Sandy or many of these other events, what we find is that those formal response systems parachute in and kind of run roughshod over or bulldoze over all the community efforts that have been assembled until then, rather than working with them and alongside them and building and supporting that capacity. They basically ignore it or tear it all down and impose their own solutions from outside. And so we're really looking at how do we create a culture of community development and capacity building and collaboration. And there are, kind of general models out there about community resilience building that emphasize this, but provide very little actual instruction for people, especially, emergency management personnel who tend to be very technically minded and very oriented to hard infrastructure like roads, bridges, facilities, energy systems, and less well-trained and observant and responsive on the social infrastructure side, which is, how communities operate, what are the communication channels between people, how to work effectively with volunteers. And we see also in many disasters that there's an outpouring of people wanting to volunteer, both within communities and from beyond. And most response agencies don't know how to deal with that very well. They turn a lot of people away, or they say, well, you're not properly trained, or you don't have the insurance coverage, whatever. And so we squander a lot of goodwill in our systems by not being more sophisticated in how we address these what are effectively opportunities. We squander the opportunities and the capacity that's there.
I'm curious to know, following up on that, do you know of any best practices where this has been applied, where communities have been recognized for the wisdom that they hold, for the leadership that they hold, for the potential solutions they can generate in conjunction with formal approaches?
Yeah, to be honest, the best I've seen is the connected community approach. That's why we've started working with the Center for Connected Communities. And it's based on 20 years of experience in the Kingston, Galloway, Orton neighborhood in Toronto, working with racialized and low-income residents, not just to be a community hub that coordinates services, but to actually bring residents and agencies and programs together to be responsive to community input and longer term community vision. Because as you know, often programs are short-lived, they parachute in, they might do a bit of consultation, but there's no responsiveness to the longer term vision held by residents, especially low-income residents, for what they want their neighborhood to develop and thrive and flourish over time. And so having an anchor or backbone organization that can act as that kind of a hub with a strong community development orientation, as opposed to just a service provision coordination orientation, makes a huge difference. Because residents, you know, individually and in small groups are not always well capacitated to do that work, especially when they're in survival mode and at the receiving end of, you know, discriminatory systems. And so having an attentiveness to capacity building and the wisdom that residents hold and the connections and the networks that are well established within many disadvantaged and marginalized neighborhoods is so vital.
Absolutely. I'm actually like taking a look at I opened up the link that you sent and it seems super, super interesting. So looking forward to checking that out after this.
Yeah, thank you.
Monica, did you want to?
There were some questions from the audience. I didn't mean to interrupt you.
Oh no, I was actually leading to that too. I wanted to know if you wanted to bring those up.
So one question is, what would a successful transition from external to local mental health support look like, considering how some community members in High River noted how helpful it was for them to open up to professionals who were outside of their community?
Can you repeat the first part of the question?
So what would a successful transition from external to local mental health support look like?
Okay. That's a really interesting question, because on the spur of the moment, and this is where, you know, there were somewhat mixed messages from the people that we interviewed and spoke with in High River. And it's, I guess, could be summarized in the term ambivalence about outside help, because on the one hand, sometimes local agencies and services are overwhelmed and they're dealing with their own issues. You know, their workers live in the community and have had to evacuate as well. They don't always have the capacity for a full response to the groundswell of community needs in the immediate aftermath of an event. And you know, these are often community servers that are chronically underfunded. So they barely have the funding to meet, you know, the chronic level ongoing demand, not a surge like this. So to meet the surge capacity, we need outside agencies coming in. The problem in this case, and this is not unusual from what we see in other areas, is that these services parachute in sometimes with very little or no consultation with the community. First off. Secondly, they're time limited. So as Kabisha mentioned in her summary of our paper, people develop attachments and trust relationships with key mental health providers who are from the outside, but they're only funded to be there for, you know, a matter of months or a year or two. And then when those services are withdrawn, if those needs persist, then in fact, they've got to start that relationship all over with whoever they can find locally to continue that kind of service provision. And one of the interesting things for me in this work was really uncovering the long-term nature of mental health impacts. And this was a key learning for me, and something that I've taken into other parts of my work that I hadn't fully appreciated before this research, which is that in the immediate response to an event, you're in survival mode and you mobilize to help yourself, your family, your neighbors, and you're on an adrenaline rush of getting things done and doing what you can. And there is a certain kind of almost post-traumatic growth associated with that. There's a certain kind of high in the moment, and it carries you through sometimes for quite a while. And it takes a while before perhaps your parts of your house have been gutted and rebuilt and you can move back in. And then that's when the rest of the penny drops, where it's like supposedly you're back to business as usual, but everything you've kept at bay in terms of the emotional impact of all that turmoil comes rushing back in, and you're not always prepared for it because nobody really warns you that you thought you were doing okay, and suddenly all this stuff comes flooding back in, literally and metaphorically. And then the services are gone at that point. And so we found actually that a lot of people 5 years after this flood were still struggling with psychosocial impacts. And our services are really not set up to appreciate that and to work with that. And so that transition from the outside to the local services was a difficult one because the communication channels between those two groups were not well established. The government that was, and the other services like Red Cross that were providing the funding for the external services did not, as far as we could tell, broker a series of ongoing collaborative conversations about how to make that transition. It was basically like, well, our funding runs out in 6 months or X number of years and we'll be gone, and we hope you pick up the pieces. Sometimes there was additional funding provided for the local providers to enhance their capacity to meet those transition demands, but I think we need to do a much better job of that. And the piece also that we reference in the paper that I find super interesting, and we reference this actually in a Yes Magazine article about 5 ways that communities are meeting mental health impacts at a community and a mutual aid level, is being better at training people who come into contact with folks on a regular basis in the community. And we've seen this in a few other places. So giving minimal training, and this can be done over a couple of hours, to people like barbers and hairdressers, right? Because people talk to in the community that they may or may not know, but where things would come out, where if those people had a little bit of training about how to be empathic and how to work with people, and maybe places they can refer people when someone seems really upset, that kind of training of kind of community folks on the front line, if you will, of mental health could do so much good at being a bit of that interface between formal systems, which are underfunded and can't be everywhere for everyone, and the folks who are really, in a sense, the community level front line. The coffee shop owner and the hairdresser and the other people who people come into contact with and who will often be talking about these things.
Oh, were you going to say something, Monica?
No, go ahead, Kabisha.
It was just a thought. I think as you're talking about the folks on the front line in the community setting, I was even thinking that, in communities, you have certain folks who have more skills in that empathic listening and that being able to care, to do more of that care work. And so that could be a potential for even skill sharing within a community, for recognizing the skills that community members themselves have, and to share that with each other and to learn from each other. So I've seen it happen in the neighborhood where I grew up. And so I think that could be also a potential to flesh out and to grow from.
Yeah, there was, I can't remember if it was in High River when they did this or another community. I could have looked it up, I guess, before this webinar, but there's something like a yellow dot program where if you're open to those conversations and maybe have a bit of training around it, you just put a little dot in the window of your store or cafe or whatever, and it just lets people know you're there if they want to talk. And it really expands the level of mutual aid and support and mental health support that is available to community members, especially people who may, experience barriers to inclusion in formal response systems.
Yeah, absolutely. Okay.
Just a follow-up question from the audience, and I'm also very curious to know as well. So the topic of climate change, as you know, can be very polarizing, especially I imagine in areas such as rural Alberta. And I know you talked about within your discussion that whether at the individual, the key informant, or the provider level that you discussed in your paper, how some participants might be skeptical about climate change. And so one thing I was kind of looking for within your discussion was that I think is important to note here is how might that skepticism affect how the role of psychosocial interventions or policy development in this area. So for example, in your discussion, you talk about how interventions might be offered for a short-term period, and you highlight the challenges associated with that as you've been discussing. So if you're thinking that there's a flood, if you're a resident and you're thinking the flood in High River potentially might be, a singular event or something that might not occur as often, how do you think that thinking may influence the type of resources provided as well as access to resources that these communities may have? And I'm also particularly interested in, if you had any kind of pushback or tension from potential residents or people or participants within the study.
Yeah, for sure. There's a lot in there.
There's a lot.
And, yes, I mean, one of the issues of doing this work in rural Alberta is, not everyone is on the climate change agenda or is willing to see this as connected in some way to climate change. What we found helpful in part by bringing a political ecology lens to this is to understand that whereas that could be framed in typical kind of climate denier terms, if we dig a little deeper, we see that actually people have a lot of reasons not to want to believe because they don't want to face the possibility of having to go through something like that again. Or they don't want to, there's like a cognitive dissonance to be overcome between, their livelihoods or their sense of a future for themselves and their children and the possibility that this may become a more frequent and more severe kind of thing. So it's not just that people might be aligned politically in certain ways or be climate deniers in the way we tend to use that term in almost dismissive ways, but we can understand that when you're embedded in that context and when your social networks are not really discussing or bringing this up or raising concerns, there's also all of the kind of reluctance to acknowledge the possibility of having to go through something like this again and what that might mean in terms of upheaval, or even should I be thinking about moving before that happens again? And what do I do with my sense of community and attachment here, et cetera? We realize that people have all kinds of reasons to not want to go there. And in fact, even with how we did this study methodologically, we had to be careful about when and how we introduced the climate change topic. So it actually was the last two questions in our interviews. And what we found also in other work is sometimes it's good to frame that in a third person kind of way to say, some people say that these events are linked in some way to climate change. What do you think? Rather than saying, this is obviously, going to increase with climate change and shouldn't we be factoring that into our mental health, work. So that gives people more of an opening to agree or disagree and to tell us how they see it. And, there was a big divergence, not just among community members, but also among the service providers that we saw, which in some ways has some interesting implications for how they counsel people if you're a bit in denial. But part of the analysis we did was maybe not so evident in this paper, but it came out in some of the other work, was just looking at the broader context of the Alberta government having licensed clear cutting of the forests upriver from High River. So in fact, policies of resource exploitation actually increasing the vulnerability of downstream communities like High River to, future catastrophic flooding, because you erode the capacity, literally, of the landscape to absorb, you know, extreme rainfall and other events. And so some people drew attention, you know, they were aware of this and drew attention to this, and other people, you know, because that doesn't typically make them the evening news, were kind of more oblivious. So we didn't do kind of a class and social position analysis of where people stood, but generally, I think more broadly, we find that there are certain kinds of privilege, especially in the way they're aligned with the status quo, that make it more difficult for people to acknowledge not only climate change, but the differential impacts of not only extreme weather events and climate change itself, but also the differential impacts of how the response mechanisms. And we see that now with COVID, right? That it took a long time to acknowledge that, you know, it wasn't actually, you know, we're all in this together. We're all in this very differently based on our privilege. And not only that, but the responses to COVID, like lockdown, like, you know, exemptions for quote unquote essential services, put racialized and low income communities who are overrepresented in precarious employment and essential services at additional risk. And that in the public health discourses around you know, self-isolation at home and so on, completely ignore the realities of overcrowding, of, you know, a lack of access to sick pay and sick leave, et cetera, et cetera. So we see this kind of dynamic reproduced over and over again. It's not unique to climate-related extreme weather events.
I agree. And just in the interest of time, and we have about 4 minutes remaining, I just wanted to ask, I guess as the supervisor to your PhD student, like why you chose to publish with Canadian Journal of Public Health.
Why I chose
to publish in the Canadian Journal of Public, to publish in the Canadian Journal of Public Health, and I think it links really well with your comment towards health equity.
Yeah, well, I think first of all, this was a paper that's connected to a special issue on climate change. That a couple of us were involved in pulling together. Secondly, I think many of the messages we have in this paper are really also directed at a public health audience, because I think we in public health need to be more consistent in our acknowledgement of the uneven impacts and of the psychosocial dimension of climate change impacts. And we haven't even talked here in the paper or in this discussion about the psychosocial impacts of impending climate change, which is a whole other topic, right? We see especially today's youth faced with all of the doom and gloom around environmental collapse and so on. That has a huge psychosocial impact of its own, quite apart from having lived through specific climate-related events. And we need to, I think, public health in some ways has more experience than other sectors in intersectoral work, and in, at least in some limited circles, in more of a community development approach. For example, the mandatory service and program guidelines for Ontario have long had a clause in them about the need for public health to work with other non-public health players to ensure that social determinants of health are addressed in a full spectrum of community contexts. And so public health, and this varies by jurisdiction, of course, but has a fair amount of experience doing that kind of collaborative work with community organizations and groups. I think we have a long way to go in that regard. But, you know, part of this message is hopefully kind of expanding that work and building on that base of experience.
That's great.
And I'm mindful Kabisha had a whole pile of questions you haven't had a chance to ask yet.
That's okay. I wanted to make sure that we prioritized participants' questions. So I'm really glad to hear all these questions and insights. So I'll set up another meeting with you, Blake, and I'll throw them at you.
We need another.
May I also encourage you to kind of ask those questions on Twitter, because I'm sure there's lots of questions in terms of you had or methods questions that people may have. I may also encourage you to do that just before we close out. We do have 1 minute remaining, and I just want to plug some stuff. So our next Journal Club session will take place on December 16th, where we have Mame here will discuss the paper Identifying Visible Minorities or Racialized Persons and Surveys Can Be Just Asked with author Greta Bauer. And CPHA's members can register for free when logged to the CPHA member portal, and non-members should register from the webinar series page on CPHA's website. We also have next week, and so you are able to register today for the, You're able to register today for the Canadian Immunization Conference that's taking place next week from December 1st to 3rd. The scientific program will include over 30 sessions with some leading public health figures, including Dr. Lisa Tam, Canada's Chief Public Health Officer. Attendees will be able to gain additional learnings through unlimited on-demand access to the presentation gallery for 1 year post-conference, and we're pleased to provide a discounted student registration fees. And on behalf of CPHA and the Canadian Journal of Public Health and the participants of today's session, I would like to thank our speakers, Kabisha and Blake, for this wonderful group for conversation. I look forward to hosting you next month and also continuing the conversation on Twitter. And we will share today's slides and webinar recording within 1 week. And so please take a moment to fill out the brief feedback survey with you guys. And the last thing is, if you have not yet, we do encourage you to become a member. And membership is a great way to connect with other Canadian public health professionals, and there are many benefits to joining, including student opportunities like free access to these webinars or other ones, eligibility to participate in our mentorship program and leadership roles. And if you're interested in becoming a member and learning more about the current student early career opportunities, I'd be more than happy to have a one-on-one conversation with you. And please feel free to reach out to me by email at students@cpha.ca. Thank you.